Thank you for the opportunity. Various studies have shown that the true muscle ATP and nitric oxide levels are altered in underactive bladder. Animal studies by Munoz and et al. Have shown that urinary ATP ratio is decreased in underactive bladder. Till date, there is no studies which evaluated the role of both urinary ATP and nitric oxide levels in human bladder, especially underactive bladder. So, keeping that in mind, the aim of our study was to study the association of urinary ATP and nitric oxide levels in patients of underactive bladder, and to study the association of urinary ATP and nitric oxide levels with various urodynamic parameters. So it was a case control study done over a duration of 18 months, and the inclusion criteria was all urodynamically diagnosed cases with a BCA of less than 100 due to any etiology and age group more than 20 years, and the exclusion criteria was patients already on prolonged catheter, active urinary tract infection, and chronic renal failure. So age and sex matched healthy subject acted as the control. 2 consecutive freshly voided urine samples were collected and stored at minus 20 degrees Celsius, and then it was evaluated for both ATP and nitric oxide levels using ELISA. So independent t-test, chi-square test, Fisher's XR test, and PSN correlation coefficient and ROC curve was plotted. So 30 cases, 20 controls, mean age was comparable in both cases and controls. Out of the 30 cases, benign prostatic hyperplasia turned out to be the most common etiology, followed by idiopathic. And this is our result. Urinary ATP levels were significantly lower, and urinary nitric oxide levels were significantly higher in underactive bladder subjects, and urinary ATP nitric oxide ratio was significantly decreased in underactive bladders. So we plotted an ROC curve using the nitric oxide levels. So the area under curve turned out to be 0.828, which shows good separability between cases and controls, and at a cutoff of 1170.52 picogram per microliter, it has a sensitivity of 86.7% and specificity of 80%. So, but we couldn't get any correlation between these levels and the urodynamic parameters. So conclusion, underactive bladder was significantly associated with higher urinary nitric oxide level and lower urinary ATP levels, and it suggests a possible role of ATP and nitric oxide in the pathophysiology of underactive bladder, and urinary nitric oxide levels can be used as a non-invasive alternate test for diagnosing bladder underactivity. Whether urinary ATP nitric oxide can be used in the treatment follow-up should be ascertained with further studies. Thank you.
I have a technical question first. The error bars that you had in the abstract in the presentation, are these standard deviations, standard errors, or what are they? The error bars. Yes. You have both in the abstract and your presentation.
They're standard deviations.
Standard deviations, yes. Okay. If I recall the slide you had correctly, the two groups were different but overlapping quite a bit.
Yes.
If they are overlapping quite a bit, how do you envision using that as a diagnostic test?
So the values were almost similar, but the significant, it turned out to be very significant in the sense for as a screening test. So that the actual values were both ATP and nitric oxide values were almost similar in both cases and controls.
So just from a practical point of view, if they're very similar, how do you, if you use that as a screening test, how do you decide which value then should prompt further investigation and which value should not?
So that's why we opted for ATP nitric oxide ratio. So this ratio will be decreased. It is considerably decreased in patients with underactive bladder.
And that choice was made after you had seen the data or before?
So this was a part of my MS general surgery thesis. So this was made before seeing the data.
Tony?
Interesting study. How do you know what the sort? Well, so for example, you could have an inflammatory response and have inducible nitric oxide synthase and have considerably high levels, which wouldn't correlate with what you're suggesting.
Yes, sir. That's why we I haven't included it in the slide. That's why we checked the urine culture of and urine routine examination was done for all subjects and both cases and controls basically.
No, it doesn't have to be bacterial, inflammation. But again, and I won't drag on this, but there are many, many sources for nitric oxide. I'm not sure that and then measuring it is complicated. How actually did you measure it?
Nitric oxide? Yes, sir. It was double antibody sandwich ELISA and photometry.
Like chemiluminescence? Oh,
No.
you're saying an electrode?
Of photometry.
Photomet.
Go ahead. As the question, I understood that you measured ATP through ELISA?
Yes.
Or why didn't you use a luminescence method? You used two. Another question was you had two voids. Patients void, they have two samples.
Yes, sir. Two samples consecutively. Basically, we have just to avoid the error. Basically,
there was how was the variability between the two voids?
so the variability was different. Actually, the volume that we could get, it was different both times.
Any further questions or comments? If that is not the case, thank you again. And